Hello, dear students. Very warm welcome to all of you at our conceptual brainstorming integrated session of the pathology. And right now, we are going to integrate this pathology topic, portal hypertension. Very important topic with our medicine, with our surgery, with our gastroenterology portion. So, as the name is suggesting, the portal hypertension means there is a more and more pressure in the portal vein. Can you recall? Can you integrate with anatomy? I taught you in anatomy that portal vein is equal to superior mesenteric vein plus splenic vein. Yes, at the level of L2 behind neck of pancreas. This was the very important statement which I told you at time of the anatomy class. Okay, और वहां पर मैंने आपको बताया था portal vein is equal to 2s ss. So one MCQ, vertebral level is the another MCQ, and behind the neck of the pancreas this is the our another third MCQ. तो आप यहाँ पर देख रहे हैं, yes, this is our spleen. Okay, and here is our GIT portion. Yes, sir. So the splenic vein and our superior mesenteric vein, splenic vein and superior mesenteric vein, 2s are uniting. Okay, yes, yes, please improve this one. This is the our superior mesenteric vein, this is the superior mesenteric vein. So splenic vein and superior mesenteric vein both are uniting behind the neck of the pancreas at the level of L2. So there is a formation of the portal vein. This particular vein is our portal vein, which is dividing to the right and the left division and supplying the our liver. Remember, the main blood supply of the liver is portal vein, which is supplying approximately 80% of the blood. It is supplying approximately 80% of the blood. Getting the point? And what is this? This is our inferior mesenteric vein, which is opening into the splenic vein. Getting the point? Okay. So normal pressure within the portal vein, that is 15 to 30 mm of saline. But there are the few situations when the pressure is exceeding more than 30 mm of saline. Again, different books, different author, different countries, different person. The value may vary. Okay. So the pressure of the portal vein I told you. But if there is an excessive pressure in that situation, the blood, the fluid is accumulating here and it is making the backflow, and the blood is accumulating in the spleen, blood is accumulating into the superior mesenteric vein, inferior mesenteric vein. So there will be the splenomegaly, there will be the blood accumulation within the our veins of the GIT rectum anal canal. So there will be the bleeding from the rectum anal canal, that will be the hemorrhoids. Also you can say piles. Also there will be the bleeding. Yes, not exactly the bleeding. Yes, blood is reaching around our umbilicus part. So there is the dilatation, abnormal dilated tortuous vein you will see, that is caput medusae, and also the lower part of the esophagus are connected with this portocaval anastomosis. So there is the esophageal varices, and excessive fluid is filtered, so that will result in the fluid accumulation within the our abdominal cavity. The free peritoneal fluid within the abdominal cavity is known as ascites. Yes, we had seen in our anatomy also. So right now we are going to look this topic in a very interesting way. Yes, try to understand and preparing the all the notes. See here, normal portal vein pressure. Remember that is 15, or you can say 10 to 15. 10 to 15 mm of saline. Got the point? Now try to understand our further more things, that our pressure when it is exceeding portal hypertension, when it is exceeding more than 30 mm saline, then you will say portal hypertension. Okay, so what is the our situation? Portal hypertension, how can you define? तो कभी भी अगर एग्जाम में कुछ चीज आता है, सबसे पहले आपको डेफिनेशन देना है. यस, definition. What is the definition? Try to understand. Yes, this is our increased, abnormal increased in pressure of simply the portal vein, that is exceeding more than 30 mm of saline. Okay, so portal is indicating the portal vein, hypertension is indicating our increase blood pressure. Okay, now again try to catch the point with our anatomy. See here, we had learnt that there is our splenic vein. Yes, spleen is there. From here splenic vein is coming. Fine, sir. This splenic vein is uniting with our superior mesenteric vein, and then both are continuing as the portal vein, diagrammatic presentation. Then this portal vein is dividing into the right and left division. Fine. And giving, yes, providing the blood to the our liver. So there is our right and left lobe of the liver. Getting the point? Okay. Here is our right lobe and then left lobe of the liver. This structure is our spleen. Here you can see the splenic vein. Another structure is our superior mesenteric vein. There is a formation of our portal vein at the level of L2, where remember behind neck of pancreas. Okay, here the different branch you can see, the right branch and the left branch. Got the point? Now try to understand our further more points. I am writing the left branch here. Fine. So there is the situation of the portal hypertension. This portal hypertension can be divided into the three categories. What are the three categories? Yes, if the pathology is before the liver, pre-hepatic portal hypertension. If the pathology is inside the liver, hepatic portal hypertension. If the cause is after the liver, means post-hepatic portal hypertension. So this is our normal anatomy. Okay, first of all. Okay, now what are the different types? As you all know that it is connected with our different structure sites of the portocaval shunt. I am not telling you because you know from the anatomy part. Now we are going to make the classification. Yes. So what is the classification of the portal hypertension? So again try to understand. Suppose this is the liver. Fine. You all are aware that our inferior vena cava, I am using the dark blue color, that is formed by our right and left common iliac vein, which is formed by our internal iliac vein and external iliac vein. Do you remember our anatomy classes? Okay, world famous anatomy classes. So you all are appreciating too much. I am thankful for that. And can you see this is our inferior vena cava, which is formed by our right and left inferior vena cava. It is passing from the posterior surface of the liver. Yes, sir. And then it is reaching to our heart. You know. So try to understand this situation. Yes. Here is our heart. Where? Right atria. Yes, here is the superior vena cava. Fine. These are opening in the right atria. So what I want to tell you? Superior vena cava, inferior vena cava. But again try to understand, there is the portal vein also. Where is the portal vein? See here, splenic vein and our superior mesenteric vein both are uniting and making the portal vein, and then it is dividing into the our two different branches. Yes, 1 and 2. Diagrammatic presentation. Now try to understand these portal vein, they will create the our portal venule, sinusoids, okay, and then they will drain into the center vein, and from the center vein, hepatic vein, which is opening in the inferior vena cava. So just one diagrammatic presentation. एनाटॉमी हम डिटेल में देख चुके हैं, अभी हम सिर्फ डायग्रामेटिक प्रेजेंटेशन कर रहे हैं. सपोज दीज आर आवर sinusoids, fine, and ultimately there is the formation of the our hepatic vein. There are the three hepatic vein, you can recall the anatomy, getting the point. So what I want to tell you, there are three types of the our portal hypertension classification, okay. So if there is cirrhosis of the liver, then it will be known as, okay, our intrahepatic hypertension. Try to understand again. Here is the word spleen. Yes, sir. And this portion is carrying the blood from our GIT. Okay. So here is our GIT, or you can say anal, canal, rectum, this all the parts. Fine. And also I want to inform that here is our opening of the inferior mesenteric vein. So this is our inferior mesenteric vein opening into the our splenic vein. Okay. So this is our inferior mesenteric vein. Fine. I have shown, that's why I am not showing here. Okay. तो अब समझने की कोशिश करते हैं, अगर मान लो किसी पेशेंट में लीवर में सिरोसिस हो गया, फाइब्रोसिस हो गया, ओके सर, in that situation blood is getting accumulated in the portal vein, and all the signs of portal hypertension, means esophageal varices, caput medusae, and our hemorrhoids, you know anatomy, okay, they all will be manifested. तो इसे हम कौन सा पोर्टल हाइपरटेंशन कहेंगे, खुद सोचिए. अगर मान लो यहाँ पर फाइब्रोसिस हो गया, so the blood is coming from the splenic vein, blood is coming from the our superior mesenteric vein, the blood is reaching into the portal vein, but now the blood is not going into the our liver portion, it is not reaching into the our liver properly, so the blood is getting accumulated within the portal vein. Portal vein का pressure बढ़ गया, this is known as portal hypertension. Got the point? Okay. So what I want to tell you, yes, such kind of the portal hypertension known as intrahepatic portal hypertension. Yes, many causes are there. एक cause मैं आपको बताना चाहूंगा, that is cirrhosis. Yes, cirrhosis is inside the liver, getting the point. But there are the few other causes, like if due to any mass, due to the obstruction, there is the blockage in the portal vein, there is a clot formation in the portal vein. In that situation, the blood is filled within the splenic vein, superior mesenteric vein, inferior mesenteric vein, and it is accumulating in the portal vein and now not draining into the liver. But this is now known as our before the portal vein, before the liver. So this situation is known as pre-hepatic portal hypertension. Getting the point? Okay. Yes, this pre-hepatic portal hypertension, many causes are there, like due to portal vein thrombosis. Okay. And then there are the different our hepatic veins are there, but sometimes there is problem, not no problem in the portal vein, no problem in the liver, but many times the blockage is in the our inferior vena cava, or it may be there is a right ventricular failure. Go for our heart video. So the blood is accumulating into the right atria, so the blood is accumulating in the our inferior vena cava, so it is causing the increased blood accumulation in the inferior vena cava, increased blood into the our liver, and increased blood into the portal vein. फिर से portal vein का pressure बढ़ गया, तो ये liver के बाद का phenomena. You have to think the blood from the portal vein to the upside. दैट्स व्हाई दिस इज अवर प्री हिपैटिक, हियर इज अवर हिपैटिक और इंट्रा हिपैटिक पोर्टल हाइपरटेंशन, और इसके बाद अगर कोई कॉज है तो उसे हम कहेंगे यस दैट इज अवर पोस्ट हिपैटिक पोर्टल हाइपरटेंशन। इसके बहुत सारे हम कॉज देखेंगे, लेकिन एक कॉज जो हमें याद रखना है, देयर आर द पोर्टल, देयर आर द हिपैटिक वेन, सो ब्लॉकेज ऑफ द हिपैटिक वेन, द ब्लॉकेज वेनो ऑक्लूसिव डिसीज, वेन्स जो है वो ऑक्लूड हो जा रहे हैं, वेनो ऑक्लूजन ऑफ द हिपैटिक वेन्स, दैट सिचुएशन इज नोन एज बुडचेरी सिंड्रोम, बुडचेरी syndrome. Getting the point? Now you can say Buddcheri or Budcheri. Okay, both are correct. So this is the your short and sweet way to understand the classification, and I want to tell you that it will be very useful. It will be very useful for your medicine, surgery, patho integration. Okay, so it is very important, और आप वहां पर हिपैटिक की जगह में साइनोसॉइड वर्ड भी सुनेंगे, सो देयर विल बी द प्री साइनोसॉइडल, पोस्ट साइनोसॉइडल, this all kind of the term also will be used, pre-sinusoidal, post-sinusoidal, sinusoidal portal hypertension, this all the things will be also seen. Fine. So this is the your pick of the day. Please make it wallpaper and revise again and again. Okay, now we are going to proceed further. Yes, so try to understand our different more points. After this all, you can follow your textbook. For the classification, causes of the portal hypertension, this is important topic for the patho and more important topic for the surgery and the medicine. Yes, you can see the major causes of the portal hypertension. इसमें आप देख रहे हैं the cause which are intrahepatic, the causes which are post-hepatic, the causes which are pre-hepatic. So these are the our three categories. Okay. तो इंट्राहिपैटिक कॉज, लीवर के अंदर कौन कौन से कॉज होते हैं? डेफिनेटली सिरोसिस, वी हैड सीन। इसके अलावा लीवर के अंदर कैंसर हो जाता है, मेटास्टेटिक ट्यूमर, हेपेटोसेलुलर कार्सिनोमा, यू कैन से यस द बुडचेरी सिंड्रोम, ये लीवर के अंदर के कॉज में भी आएगा और पोस्ट हिपैटिक में भी आएगा। गेटिंग द पॉइंट? दिस पोर्ट बुडचेरी सिंड्रोम इज नथिंग, दिस इज अवर hepatic vein obstruction. Recall our anatomy classes, they are the three hepatic vein, right hepatic vein, middle hepatic vein, and our left hepatic vein, which are draining the blood from the liver into the inferior vena cava, इसमें obstruction होना है। Fine. Also there are the different kinds of veno-occlusive disease, different granulomatous disease and extensive fatty changes, these may be also responsible. पोस्ट हिपैटिक की बात करें तो कंजस्टिव हार्ट फेलियर, क्योंकि वो लीवर के बाद है हार्ट, कंजस्टिव पेरिकार्डाइटिस मींस द डिसीजेस रिलेटेड विद द अवर हार्ट, इट इज ड्रेनिंग द ब्लड फ्रॉम द लीवर टू द inferior vena cava देन द हार्ट। तो हार्ट में कोई भी प्रॉब्लम हुई आप उसे पोस्ट हिपैटिक में काउंट करेंगे। ऑल्सो द बुडचेरी सिंड्रोम यू कैन काउंट एंड हिपैटिक वेनो ऑक्लूसिव डिसीज, these two disorders are common in the inside the liver and our outside the liver, so these are common. Fine, इसे आप दोनों में काउंट कर सकते हैं। वाइल द प्री हिपैटिक, लीवर के पहले क्या क्या कॉज हो सकते हैं? पोर्टल वेन में ऑब्स्ट्रक्शन हो सकता है ड्यू टू द एनी ट्यूमर, देयर इज ऑब्स्ट्रक्शन इन द पोर्टल वेन, सपोज पैनक्रियास के नेक में ट्यूमर हो गया तो पोर्टल वेन ऑब्स्ट्रक्ट होगा ही होगा। देयर इज अ माइलोफाइब्रोसिस एंड कॉन्जेनाइटल एब्सेंस ऑफ द पोर्टल वेन। पोर्टल वेन है ही नहीं तो पोर्टल हाइपरटेंशन आपको देखने के लिए मिलेगा। फाइन, नाउ try to understand if there is a portal hypertension, then what are the different symptoms you can observe. This is again diagrammatic presentation. So try to understand, अगर पोर्टल हाइपरटेंशन हुआ तो लीवर का इन्वॉल्वमेंट आपको देखने के लिए मिल सकता है, क्योंकि मेजर कॉज ऑफ द पोर्टल हाइपरटेंशन इज cirrhosis. Okay, so here you are looking the pathogenesis as well as sequel. Also you can say the clinical features. Fine, we had seen the classification, that is saying also about the etiology. Okay, so you can say this is our etiology. Okay, तो ये etiology में भी सेम चीज आप कह सकते हैं. Try to understand in this diagram. Yes, portal venous hypertension is there. Okay, so the blood is accumulating into our splenic vein, splenic venous congestion, splenic venous dilatation. Spleen is getting enlarged, splenomegaly will be seen, congestive splenomegaly जो हमने अपने जनरल पैथो में देखा हुआ है. Yes, blood is accumulating into superior mesenteric vein, so the fluid is coming into the our abdomen ascites. It is anastomosing with the our inferior vena cava in the rectum anal canal, so blood is coming out, resulting in the blood in the fecal material in form of the piles or the hemorrhoids. Also the caput medusae will be seen. Okay, the major cause is the our cirrhosis of the liver. और जब भी लीवर सिरोसिस हुआ तो लीवर फेलियर के फीचर्स आपको मिलने ही मिलने हैं, जो हम ऑलरेडी लर्न कर चुके हैं. फाइन, so the different kind of the features will be seen. So just once I am going to tell you what are the different features in case of the portal hypertension. Fine, yes, you can also go with this diagrammatic presentation. See here, this is our liver. Fine, so there is the cirrhosis is one of the cause for the portal hypertension. So in that situation, the blood is accumulating in the spleen. So congestive hepatomegaly, splenomegaly, cirrhosis is there. So all the features of the liver failure, abnormal liver function test, that all the things will be seen. Fine. Now try to understand. There is our cirrhosis, that's why albumin is less synthesized, तो इसलिए प्लाज्मा कोलाइडल ऑस्मोटिक प्रेशर कम हो जाता है, so it is resulting in our ascites. Fine. ऑल्सो यू कैन ऑब्जर्व सिरोसिस के कारण लीवर के अंदर वेस्कुलर रेजिस्टेंस बढ़ जाएगा, पोर्टल वेन का प्रेशर बढ़ जाएगा, इसलिए हिपैटिक लिम्फ बढ़ जाता है. So that is also precipitating in the ascites. Due to this all, there is a decrease effective intravascular volume. इस कारण किडनी में ब्लड सप्लाई कम हो जाती है. So there is a more and more aldosterone secretion, so sodium water retention, इसलिए भी ascites देखने के लिए मिलेगा. Also all over the body there will be the fluid accumulation, that is our generalized edema. So again, what I want to tell you, yes, see here, what are the different features. Suppose this is the liver. Fine, sir. Portal vein is here. Yes, sir, this is the portal vein, which is formed by the splenic vein and the superior mesenteric vein. Okay, it is carrying the blood from our spleen. Yes, there is our inferior mesenteric vein also. This superior mesenteric vein is carrying the blood from our rectaminal canal, diagrammatic presentation. Fine. It is also making anastomosis with our umbilicus. There are the different our paraumbilical veins are there which are getting dilated. Yes, there are the veins which are connected with our lower end of the esophagus. So just one simple diagrammatic presentation, quick diagrammatic presentation. Yes, just recall our anat portion. Fine. And here you all are aware that inferior vena cava is passing from the backside. I'm just making the diagrammatic presentation. This is the inferior vena cava formed by our common iliac vein, which is formed by the internal and external iliac vein. Okay. So suppose there is the cirrhosis. The most common cause is the cirrhosis. So what I want to tell you, there is the nodule formation cirrhosis. So blood is accumulating in the portal vein. So increase in the pressure within the portal vein. Okay sir, fine. So पहला चीज, yes, suppose we are talking about our cirrhosis. So in case of the cirrhosis, there is the our portal hypertension. Agree everyone? If there is a cirrhosis, we already learnt there will be the liver failure that will result in our, yes, abnormal liver function test, and this liver failure will result in different symptoms of the our liver failure features. Okay, do you remember in this class liver failure portion? Yes sir, we had seen our 21 features of the our liver failure. So recall this one. I am just indicating one line. Okay. So what I want to tell you that our 21 clinical features of liver failure. So go for that class. Okay, everyone, getting the point? Okay, sir. Now, there is our blood accumulation within the splenic vein. So splenic venous congestion, splenic venous dilatation, and the blood is accumulating within the spleen. So there will be congestive splenomegaly. What I want to tell you? Yes, there is our splenic venous congestion. There will be our splenic venous dilatation, and there will be, yes, congestive splenomegaly. Getting the point, everybody? Fine. So these are our different questions. MCQ, MCQ, MCQ. Every point is MCQ. Every point is MCQ. portal hypertension. Okay, it is very commonly associated with our cirrhosis. Why? Because of the alcoholic cirrhosis. Now, try to understand. The blood is also getting accumulated within our inferior mesenteric vein as well as superior mesenteric vein. Means these all are carrying the blood from, definitely you can say this is superior mesenteric vein. Here is our inferior mesenteric vein. They are carrying the blood from GIT. So GIT within the peritoneal cavity. Yes, free fluid accumulation in the peritoneal cavity. Blood is, yes, there is the more hemodynamic pressure, so blood is filtrating outside. So that is resulting in our ascites. Okay. Also, there is our presentation of the blood is coming in the our rectum anal canal. So that is resulting in hemorrhoids and piles. MCQ. Okay. Also, you are observing there is abnormal dilatation of the veins around the umbilicus that is resulting in our caput medusae. Got the point? Also, you will observe there is blood within the our right and left gastric vein and reaching into the lower end of the esophagus, and that will result in hematemesis, खून की उल्टियां, known as esophageal varices. Getting the point? Yes. Here is our situation known as esophageal varices. Again, I want to tell you better, each and every point is MCQ. Okay. Now, these all are our features. See here, there is a cirrhosis. So, due to the cirrhosis, the blood is accumulating. The blood is not draining into the our inferior vena cava from the hepatic vein. So, blood is accumulating in the our liver, then also accumulating in the our inferior vena cava. So, blood is accumulating into the our yes external iliac vein, which is our femoral vein. In the lower limb, it is coming from the femoral. So, blood is accumulating in the lower limb. So, blood fluid in lower limb, that will result, yes, abnormal excessive fluid where in lower limb. That is known as, that situation is known as, remember, our ankle edema or lower limb edema, ankle edema. Due to the liver failure, there is the hypoalbuminemia. That hypoalbuminemia will result in swelling, fluid collection all over the body. That situation is our generalized edema, एनासार का कहने का मतलब पेट में पानी है, लोअर लिम्ब में पानी है, hypoalbuminemia. This liver failure is resulting in our, yes, hypoalbuminemia that results in generalized edema known as anasarca. Recall our heart class. Getting the point? Very, very beautifully presented, beta. You are learning in a great way. So remember, this is, I just told you the few points. These all are our pathogenesis portion. Yes, major sequel of the portal hypertension. Fine. Ascites. Okay. Also, there are our different systemic factors. So in this systemic factors, we will learn, then local factors, the different points we will learn. Okay. तो मेजर सिक्वल में आप देख रहे हैं, आपको क्या क्या चीजें नजर आएंगी? एसाइटिस, वेराइसिस, स्प्लेनोमेगाली एंड पोर्टल, यस, हेपेटिक इंसेफेलोपैथी. तो ये चार इंपॉर्टेंट चीजें हैं. आई थिंक देयर इज एनी page is missing in this ebook, so only the ascites is given. I told you how the ascites is there, okay? And due to the ascites fluid accumulate होता है और वहां पर अचानक इन्फेक्शन हो सकता है, दैट इज स्पॉन्टेनियस बैक्टीरियल पेरिटोनाइटिस, जिसको हम SBP के नाम से सर्जरी में पढ़ेंगे, ओके? पैथोजेनेसिस वहां पर समझाया गया है, वी हैड सीन विद द डायग्राम। और सिस्टेमिक फैक्टर हमारे पोर्टल हाइपरटेंशन में प्लाज्मा ऑन्कोटिक प्रेशर कम होना है, यस, एल्डोस्टेरोन का लेवल बढ़ना और इंपेयर्ड रीनल एक्सक्रीशन, इन सभी चीजों के कारण एसाइटिस आपको देखने के लिए मिलता है। लोकल फैक्टर जिसके कारण एसाइटिस आपको देखने के लिए मिलता है, यस, इंक्रीज पोर्टल प्रेशर, इंक्रीज हिपेटिक लिम्फ फॉर्मेशन, ओके फाइन, यस, देयर इज नो मिसिंग, ओके? तो आपने यहां पर सबसे पहला देखा एसाइटिस, अब उसके बाद में दूसरे फैक्टर है एसाइटिस के बाद, यस, वेराइसिस, एंड देन देयर इज अवर स्प्लेनोमेगाली, एंड देन देयर इज द हेपेटिक एन्सेफेलोपैथी। तो ये चार मेजर फीचर आपके पैथो के अकॉर्डिंग, फाइन। वेराइसिस, देयर विल बी द इसोफेजियल वेराइसिस, यू नो द कॉज, हमने एनाटॉमी भी इसे डिटेल में देखा था। देयर इज अ हीमोरॉइड्स, देयर इज अ कैपेट मेडुसिन, और इसके अलावा रेट्रोपेरिटोनियल एनास्टोमोसिस, डू यू रिमेंबर बेयर एरिया ऑफ द लीवर, किडनी के पीछे रेट्रोपेरिटोनियल एरिया में भी पोर्टोकेवल शंट एनास्टोमोसिस होते हैं, वहां पर भी ब्लीडिंग आपको देखने के लिए मिल सकती है। स्प्लेनोमेगाली, बिकॉज देयर इज अ ब्लड एक्यूमुलेशन विद इन द स्प्लीन, ओके? And also the hepatic encephalopathy, abnormal CNS features will be manifested, okay? So here we are ending, but when we will go for our surgery medicine integrated classes, can you see, okay, here the surgery medicine integrated classes, and this 8th topic I taught there, that is our portal hypertension in the surgery medicine class। तो इसके आगे हम वहां पर पढ़ेंगे अपर जीआई ब्लीडिंग होती है किसे कहते हैं, व्हाट इज द लिगामेंट ऑफ द ट्रेड्स, कब अपर जीआई ब्लीडिंग कहेंगे, कब लोअर जीआई ब्लीडिंग कहेंगे, ओके? एंड देन व्हाट आर द डिफरेंट कॉजेस, फिर से हम एनाटॉमी की बातें करेंगे, और हम नॉर्मल बेसिक चीजों से लेते हुए, एनाटॉमी की चीजों को लेते हुए, इवन हिस्टोलॉजी के साथ कोरिलेट करते हुए, और आपको ये याद है हमने फर्स्ट ईयर का मासूम बच्चा कहते हुए अपने एनाटॉमी में एक नाचता हुआ लड़का बनाया था जो पोर्टल हाइपरटेंशन, पोर्टल वेन को इंडिकेट करता था। एंड देन all the classification we will see, okay? And the main thing, yes, this is the diagram from the anatomy, okay? ये anatomy का diagram है। तो पोर्टोकेवल शंट ऑल्सो, कैपेट मेडुसी क्या होता है, तो वहां पर हम हॉलीवुड, बॉलीवुड, टॉलीवुड के साथ इंटीग्रेट करते हुए चीजों को लेते हुए चले थे, ओके? एंड देयर इज द डिफरेंट कॉजेज ऑफ द पोर्टल हाइपरटेंशन, फाइन। और इसको हमने फिर प्रॉपर एनास्टोमोस किया था, वही डायग्राम जो भी मैंने आपको समझाया, ओके? एंड देन वी विल सी द डिफरेंट न्यू ट्रीटमेंट, क्या क्या चीजें हम इसोफेजियल वेराइसिस के लिए करते हैं, एंडोस्कोपिक क्या क्या तरीके हैं, और हम देखेंगे व्हाट आर द डिफरेंट सर्जरी लाइक द टिप्स, ट्रांसजुगुलर इंट्राहेपेटिक पोर्टोकेवल शंट, ये सारे ट्रीटमेंट हम करते हैं। और फिर सर्जरी के अलग अलग स्टेप में आपको बताऊंगा, इजी करते हुए शंट को हम समझेंगे कि कौन कौन से तरीके से हम पोर्टल वेनस प्रेशर को कम कर सकते हैं। वी विल सी द वॉरेन शंट, डिस्टल स्प्लीनोमेगल शंट, अभी आपको समझ में नहीं आएगी, इसके लिए अलग से डिस्क्रिप्शन चाहिए कि हम कौन कौन सी सर्जरी करेंगे। स्प्लेनिक वेन को कट करके हम कैसे रीनल वेन से जोड़ेंगे और पोर्टल वेन के प्रेशर को कम करेंगे, हम सीधे पोर्टल वेन को कट करेंगे और ब्लड को सीधे इंफियर वेना केवा में ड्रेन करेंगे। तो ऐसे कई सारे हम सर्जरी के स्टेप्स देखेंगे, फाइन। सो राइट नाउ व्हाट आई वांट टू टेल यू लिटिल इंफॉर्मेशन अबाउट द अवर यस इन्वेस्टिगेशन। तो इन्वेस्टिगेशन में आप क्या करेंगे, डेफिनेटली abnormal liver function test, also you will perform the other test, but in liver function test maximum things are included, even the ultrasonography, this all treatment। तो पोर्टल हाइपरटेंशन में सब तरफ इडीमा आपको दिखाई देता है, that's why definitely you will give the diuretic, you will ask the patient to decrease water intake, पानी कम पीने के लिए कहना है। तीसरा, यस, डिक्रीज सोडियम इनटेक, नमक कम खाने के लिए कहना है। गेटिंग द पॉइंट? पोर्टल हाइपरटेंशन, इसके लिए आपको क्या करना पड़ेगा, ट्रीट अंडरलाइन कॉज। तो मैक्सिमम केसेस में अंडरलाइन कॉज आपने क्या देखा था, एल्कोहल। तो एल्कोहल एब्स्टिनेंस, एल्कोहल के लिए संयम। अब हमने इसके लिए क्या क्या दवाइयां दी थी, यस, एक तो विल पावर स्ट्रांग होना चाहिए, दूसरी चीज डाइसल्फिराम दो, ओके, एकाम्प्रोसेट जैसे ड्रग हैं, आजकल ओंडेनसेट्रोन और भी कई सारे ड्रग्स हैं जो एल्कोहल को छुड़ाने में मदद करते हैं। also there are the different surgical treatment. ओके, इसोफेजियल वेराइसिस है तो हम प्रोपेनोलॉल भी देते हैं, डिफरेंट सर्जिकल प्रोसेस आर देयर, ओके, जहां पर हम पोर्टो केवल शंट सर्जरी पढ़ेंगे, जिसमें से एक टिप्स प्रोसीजर सबसे इंपॉर्टेंट है, यस, ट्रांसहिपेटिक transjugular intrahepatic, that is a transjugular intrahepatic portosystemic shunt. Okay, so this is more and more detailed beyond our pathology aspect. So thank you very much, god bless you all. Now we are starting our live doubt discussion session. आगे की चीजें बेटा नेक्स्ट टाइम हम अपने सर्जरी मेडिसिन इंटीग्रेटेड क्लासेस में करेंगे. थैंक यू, गॉड ब्लेस यू ऑल.